TIF, transoral incisionless fundoplication, is an incisionless surgical procedure that reconstructs the body's natural physical barrier to reflux. Inserted through the mouth, the Esophyx device is used to reconstruct a 3 to 5 centimeter, 270 to 310 degree anti-reflux valve. TIF is surgery without incisions, or the complications associated with more invasive surgical procedures. TIF is performed under constant visualization. While under general anesthesia, the Esophyx device, riding over the endoscope, is gently glided down through the patient's mouth into the stomach. The stomach is inflated, and the endoscope is advanced and turned into a retroflexed view so that it is looking up at the gastroesophageal junction. The tissue mold is then advanced into the stomach. The helical retractor is engaged at the opening of the gastroesophageal junction. The tissue is then retracted into the tissue mold. If present, a small hiatal hernia can be reduced, and the esophagus can be lengthened by retracting the endoscope and locating the Z-line. Suction is then engaged, enabling the invaginator to gently reposition the Z-line down below the diaphragm. The Esophyx device is then rotated, wrapping the fundus toward the lesser curvature of the stomach. Under visual control, the Esophyx device then deploys 2 non-absorbable polypropylene H fasteners 1 centimeter above the Z-line. These proprietary fasteners have been designed to secure full-thickness serosa to serosa tissue folds without a crimping mechanism. The wrap is then tightened farther toward the lesser curve, and the next pair of fasteners are placed 1 centimeter above the Z-line. This procedure is repeated on the opposing side, creating a tight omega-shaped valve. Then a 3 to 5 centimeter flap is created at the 5 o'clock and extended to the 7 o'clock position along the greater curvature for a total of 12 fasteners, creating a tight 270 to 310 degree wrap. TIF is long-lasting. Studies show that in the weeks following TIF, serosal fusion occurs, creating a layer of fibrous and fibroelastic tissue to bond and secure the tissue folds. Durability of the valve and clinical efficacy have been confirmed in long-term studies. TIF emulates time-proven surgical procedures. Clinical results have been excellent, comparable to more invasive procedures, but without incisions or the long-term complications associated with laparoscopic procedures for reflux.